morning, everyone. My name is Jocelyn Hanson, and I am a mom who just completed the Children's Home Society of New Jersey's Body and Soul Prenatal Health Education Program, right here in the capital city of Trenton. I live in Trenton, and I am so very glad that Governor Murphy will sign today a bill making a first in the nation state maternal and infant health innovation center. Black and Hispanic women in Trenton and Mercer County have worse rates of preterm births and low birth weight births, which can cause many health problems for the baby. Preterm births were 11.9% for Black women and 8.1% for Hispanic women in Mercer County, far higher than for white women, according to New Jersey Department of Health data. Low birth weight births were 12.4% for Black women and 5.4% for Hispanic women in Mercer County. This center is so important for moms, birthing people, and families in Trenton and Mercer County because the center will support organizations like Children's Home Society that directly help moms like me. As a result of initiatives such as their Body and Soul program, pregnant women from all backgrounds and cultures are able to receive proper prenatal education, not only for themselves, but also for their unborn child. This program makes use of a specialized curriculum that places an emphasis on leading a lifestyle that provides nourishment for the soul and encourages harmony between the mind and body. This lessens the negative effects of stress on a woman's ability to have a good pregnancy and a healthy life overall. Children's Home Society has done this for me. I know the governor and the First Lady care about making things better for moms and babies in Trenton and New Jersey, so it is my pleasure to now introduce a true champion for Trenton, the First Lady of New Jersey, Tammy Murphy.
Good morning, everyone. Jocelyn, thank you so much for being here and sharing your story. We are really all so grateful to all of the mothers across New Jersey who've spoken out about their experiences. There are many friends and partners with us today, and many, many more individuals and organizations deserving of our thanks who are not in this room. To all of you, I offer my most sincere gratitude. Dr. Barbara George Johnson and her team will continue to make sure that community is at the center of this center going forward. Obviously, I also want to thank the team here at Henry J. Austin for hosting us this morning. In January of 2020, we held a press conference in this very room announcing the development of the Nurture NJ Maternal and Infant Health Strategic Plan. And fittingly, we are here again today to announce progress on one of the key recommendations of this plan. When we announced the strategic plan, we recognized New Jersey's appalling maternal and infant health crisis. And since then, we faced the heartbreaking statistics that showed our Black mothers were 7 times more likely than white mothers to die from maternity-related complications. And we faced the disturbing reality that placed our state 47th in the nation for maternal deaths. On that morning, despite the complexity and severity of the crisis and all of the challenges that we knew lay ahead, I said, today is a day of hope. In the years since, we have made meaningful progress toward our goal of becoming the safest and most equitable state in the nation to deliver and raise a baby. We have developed and released our statewide strategic plan, enacted or made headway on over half of its more than 70 recommendations, expanded Medicaid coverage to 365 days postpartum, and we are developing the most robust in the nation universal nurse home visitation program so that every new parent is visited by a nurse in their home within weeks of bringing home a new baby. I could go on, but instead I will share what our progress has brought us. This past year, the March of Dimes annual report card showed that of the 53 states and territories evaluated for maternal health, 47 declined, 1 stayed the same, and just 4 improved: Kansas, Montana, North Dakota, and yes, New Jersey. 47 declined, 4 improved. And according to America's Health Rankings, at the beginning of Phil's administration, we were 47th in the nation for maternal deaths. The most recent data shows that we have moved up to 29th. What we are doing here in New Jersey is an outlier, and that is not because our state is alone in facing a maternal health crisis. On the contrary, the United States is 55th in the world for maternal mortalities and has among the worst rates of maternal mortalities compared with developed countries. Unfortunately, the gap between rates in the United States and high-income countries is only widening. Nearly 85% of these deaths are preventable, and in New Jersey, over 90% of these maternal deaths are preventable. So, although we have made significant progress here in New Jersey, to borrow a phrase from Phil, we are not ready to spike the football just yet. Which brings us to today, which I am thrilled to share is once again a day of hope, simply because the transformative work we have led these past 6 years, the progress we have made, and the momentum we have won will all continue because of the support of so many of our partners to build our Maternal and Infant Health Innovation Center. This center will be an incubator for research and development, an academic and perinatal workforce training center, a data collaborative, and so much more. It will offer comprehensive clinical services for moms before, during, and after pregnancy. It will not only help us transform the maternal and infant health landscape here in Trenton, but also across New Jersey. And it will make our state the national model and gold standard for maternal care. For all of this, I am so grateful to all of you who have worked so hard to get us to this point. I want to add that as a mother of 4, this work has been deeply personal for me, as I think it has and will be for all who have come involved with Nurture NJ. Having just finished my term as chair of the National Governor's Spouses Association, where we also led a year-long initiative on our national maternal and infant health crisis, I can tell you that ensuring the health and well-being of our mothers and babies is something on which we can all agree across our nation. We all feel an instinctive need to protect our mothers and babies, a need to ensure that every family begins its life together in health, wellness, and joy. And I am beyond proud to see New Jersey lead this effort, improve the lives of mothers and babies here in our state and across the country for generations to come through the work of this center. And before I pass the mic, I would be entirely remiss if I did not recognize the unyielding support and commitment of Phil, who is here today to sign what will be his 44th piece of maternal health legislation. The scope of Nurture NJ's mission is by no means small, and we have only been able to set the bar as high as we have and take these groundbreaking steps because Phil, and by extension, this entire administration, truly values mothers. I have been so grateful to count Phil as a partner in our journey together as parents, and I am really equally grateful to count him as a steadfast ally to all of New Jersey's mothers, babies, and families. Thank you, and now it is my honor to introduce and welcome my best friend and the Governor of New Jersey, Phil Murphy.
it one more time for First Lady Tammy Murphy. Wow. That was darn powerful. Thank you so much for your gracious words, your powerful introduction. I don't know about you, I was taken aback to hear that we were hanging out with Montana, Kansas, and North Dakota. That's not a trio that we're normally hanging with, but very powerful. Before I get into some brief remarks, I just want to say Shirley asked me about this. I'm just in from Warren County, which is not a stop I had intended to be making on Friday when we put our schedule together for the week. But they were crushed this weekend by flooding, landslides, homes getting damaged, roads and bridges getting damaged. Just incredible devastation. It's a great, beautiful, proud county in our state, but they've been crushed. So keep them in your prayers. And fortunately, not to get on the soapbox, but somebody asked me, was I surprised? And unfortunately, the answer is no longer, given the frequency and intensity of these storms. I'm sure at the root of it triggered by climate change. We're getting dragged along, and we've got to find a way, all of us, to get out ahead of this stuff, because I meet one family or after another, one business after another, see one road after another, and it's becoming too much. We've got to be better at this. So keep them in your prayers if you could. And by the way, 4 inches of rain expected tomorrow night, which is the last thing they or we need. Again, Tammy, thank you for your incredible words and for your great leadership. Jocelyn, I was incredibly impressed. You got us off to a great start this morning. Let's hear it one more time for Jocelyn Hanson. I want to also begin by thanking, and I'll be brief, the staff here at the Henry J. Austin Center for hosting us. Let's give it up for them. I'm told a lot of your leadership is in the back of the room, which is where I used to hang out in school, so another reason I love you. But thank you for your incredible work in making quality health care accessible to all New Jerseyans. I also want to thank the great mayor of the capital city, Reed Gusura, who we'll hear from in a few moments. Mr. Mayor, we are joined by an incredible lineup of leaders today, beginning with legislative partners. Trenton's own Senator Shirley Turner is in the house. Shirley, bless you. From the Assembly, again, Trenton's own Verlina Reynolds Jackson is here. Front row seat. Right behind Verlina is their bandmate in their legislative team. Anthony Varela is here. I know Ileana could not make it. I want to give her a shout out in absentia. Ileana Pintor-Marin. Shanique Spate was very involved in this. Are you here, Shanique? I didn't see you. You have different hair or something. I didn't recognize you. And I was about to say, I want to give a shout out because he's not here either, but he's to your left. Dr. Herb Conaway is in the house. So thank you all. Janine LaRue is keeping me on my toes. I want to also, Reverend Boyer is here. Dr. Johnson was mentioned. I love you, buddy. Senator Teresa Ruiz is not able to join us, but I want to give her and all the other leaders in the legislature a big shout out for their support of Nurture NJ, which has been Tammy's maternal and infant health initiative, and the collective shared belief in addressing this critical issue. Without their collective partnership, we would not be here today, and that is true of everyone, but especially the two ladies in the front row, Shirley and Verlina, who have been with Tammy since literally the very start and led the charge on the legislative side. And the same goes, as I mentioned, for all the advocates and partners with us who have been supporting this initiative with their hard work and expertise. So a big thank you to all of you is in order. Please help me welcome the great county executive, the great Mercer County. Brian Hughes has just joined us. Can we find this man a chair? A modest. Janine, I wasn't. No, Janine. I don't think we were addressing you in that case, but thank you for. I also want to, from our team, our administration, in addition to Tammy and myself, We have the woman who needs no introduction, Mercer County's own, the Commissioner of the Department of Health, Judy Persicelli. To her right, fellow Commissioner of Human Services, Sarah Edelman, is with us. Our state treasurer, also a Mercer County product, former legislator alongside Shirley. Liz Moyo is in the house. The Chief Executive Officer of the Economic Development Authority, very important here, Tim Sullivan, is with us. And I also want to give a shout out to Stephanie Lagos, who's been extraordinary. So as Tammy said, today marks, and to all the advocates, other elected officials, leaders, welcome and thank you. This is another important step in our ongoing efforts to protect the health of mothers and infants in this state. You all have heard the data from Tammy, and it hurts to say that it is not just an American problem, but New Jersey is not immune. And it's unconscionable to see this in New Jersey, one of the wealthiest states in the wealthiest nation on earth. And unfortunately, this tragedy does not fall evenly across our communities. As Tammy said, it disproportionately affects Black and Latino mothers with tragic consequences and is a direct result of systemic racism. I think the data is nationally, and this is the part that is both heartbreaking and fills us with optimism. I think nationally 85% of deaths, mothers or infants, are avoidable. In New Jersey, that number is 90%. So I'm incredibly grateful to Tammy and all, not only our legislative leaders, but the other elements of our administration, because this is a whole of government approach. And so you heard Tammy's remarks about the strategic study and all the work they've done over these past 5.5 years. And one of the key recommendations that emerged was to establish an innovation center to ensure that our work to solve this crisis will continue for generations to come, long after our administration is gone. And again, thanks to our partners in the legislature, that is about to become a reality when I sign this bill that officially establishes the government authority that will build the Maternal and Infant Health Innovation Center right here in Trenton, New Jersey. People have asked us, what is that? What should we equate that with? And the best one for me, and I think you came up with it, was think MD Anderson is to cancer what this center will be to infant and maternal health. So it will be not just a New Jersey resource, not just a national resource, it will be a global gold standard resource, and it will be right here in the capital city of Trenton, New Jersey. The center will both drive, as Tammy said again, policy, provide badly needed maternal health care services. Here in Trenton, by the way, which I might add does not currently have a birthing center and suffers from one of the widest disparities in maternal and infant mortalities between, again, on the one hand, white mothers and babies, and on the other, Black and brown mothers and babies. In addition, the center will focus on researching innovative models of care, translating data into action, and coordinating with local, state, federal, and international agencies, as well as private organizations, importantly, to promote equitable maternal and infant health services. I want to emphasize that last point, if I may. This center will serve as a hub for a whole-of-government approach, which is why, among other things, as Tim reminds me, this is an authority. There's no one obvious part of our government to place this in. This needs to have the ability to access all branches of government, and not just the whole of government approach, a whole of community approach to drive this work, because we cannot solve this challenge without everybody's health. Again, this center will be the first of its kind in this country. I believe in the world. We believe in the world, but certainly we'll take the country for 20, Bob, and we'll come back to you in the world for 100. And it will establish New Jersey as the gold standard for maternal health care and policy. And this will build on the efforts that have come before it. Again, we are, as Tammy mentioned, some of the steps we've taken. We were second state, I believe, in the nation to expand Medicaid coverage for a full year after childbirth, so mothers have greater access to care. We're also, as Tammy said, we're also developing the nation's most robust universal newborn home visiting nurse program. We're expanding the perinatal workforce with increased opportunities for education and training. And I'm happy to say, as Tammy said, we're seeing progress. Going from 47th to 29th is a big leap, and we should feel good about that. But I don't think any of us wake up in the morning ever to say, yes, we're 29th. We're not going to stop until that 29 turns into a 1. But it does show, without question, that we are moving the needle and moving in the right direction, and we're not going to let up until we know we've cracked through all of the remaining obstacles. So we are committed to addressing this crisis because building a stronger and fairer New Jersey starts with moms and babies. We cannot have our youngest New Jerseyans start life already at a disadvantage, so we will continue to do everything we can to support moms and their children. And this center will help carry on this critical work long after our administration ends. Once again, we are enormously grateful to our partners in the legislature, the advocates, leaders here today, many of them faith leaders, and others, for recognizing the critical importance of maternal and infant health and their support in tackling this crisis. With that, it is my honor to introduce a leader on this and on so many other fronts, Trenton's own dear friend, great leader, Senator Shirley Turner.
Thank you very much, and good morning to all of you here today. This is not just a great day for the city of Trenton, but for Mercer County, for the state of New Jersey, and for the country, and as the governor said, for the world. Motherhood is one of the most powerful experiences that women have and share. However, far too often, for women in disadvantaged and underrepresented communities, a lack of care during pregnancy, a lack of resources, or an inferior level of care prevent all women from ever having that experience. Sadly, the number of maternal and infant mortality rates have steadily increased across the country, causing a staggering number of women not just experiencing the greatest of all experiences. They do not become mothers, they become statistics. But today we have, as the governor and the First Lady said, we have hope here in New Jersey, and we are on the right path for reversing that trend. I want to acknowledge our great governor and our First Lady, Tammy Murphy, for recognizing the great need that exists for improving maternal and infant health outcomes and placing a bright spotlight on the issue here in New Jersey. With the launch of First Lady's Nurture New Jersey in 2019, the stepping stones were put into place to begin to improve maternal and child outcomes and to reduce racial disparities among Black and Latina women in healthcare. When Governor Murphy first took office, as was said before, we ranked 45th in the nation for maternity mortality rates. But thanks to the leadership of our First Lady, we have made improvements. We are now, as the governor indicated, and the First Lady, we rank 29th in the country, but we're not going to rest there. And as was stated, there were only 4 other states that had made improvements in reversing preterm births. That is a record worth noting. And that will be reduced even further, because we're going to improve that number with the signing of this bill. And when First Lady Tammy Murphy contacted me to ask about partnering with her to create New Jersey Maternal and Infant Health Innovation Center, I did not hesitate to help build on her efforts and her vision to improve maternal and infant care across the state. Ultimately, we hope that the good work we are modeling and accomplishing here in New Jersey filter throughout the rest of the country and put an end to the maternal and infant mortality crisis. Our capital city is proud to be the host for this initiative. Sadly, Trenton was mentioned among the cities with the highest rates of Black and Latina infant mortality, with only 47% of mothers in Trenton receiving prenatal care in their first trimester. Those statistics cannot and will not, I have no doubt about it, those statistics will improve. Early and regular prenatal care is the single most important factor in determining a healthy outcome of pregnancy. And with the establishment of this center, we can educate more women with healthy pregnancy and put more programs in place that will direct them to the care and the care they need so sorely and deserve. Maternal and Infant Health Care Innovation Center will be a collaboration among state departments and agencies to eliminate racial disparities in maternal and infant health outcomes. It will advance and improve maternal and infant health care services throughout the state and the country. While we need to continue the work to improve the state's ranking, the reward is in making a difference in the lives of New Jersey families. We are going to save lives, improve care, and close the long-standing gap in medical care and provide the same care for all mothers and babies, because healthy and strong families are the bedrock of a thriving community and state and country. Thank you.
That was awesome, Shirley, and we wouldn't be here without you. And we also wouldn't be here without the next speaker. Again, Trenton's own. She's been at this with Shirley and Tammy from moment one. Please help me welcome another outstanding leader, Assemblywoman Verlena Reynolds Jackson.
Good afternoon, everyone, and thank you to Jocelyn and to First Lady Tammy Murphy, to the Governor, Senator Turner. I think protocol has been established, but I do want to say a special thank you to Henry J. Austin, your staff and the leadership team, our distinguished guests, and most importantly, our Trenton community residents who have gathered here today. I'm Assemblywoman Verlena Reynolds Jackson, representing the capital city in the 15th Legislative District. And I stand before you with my heart full because I've been here from the very beginning. I joined the legislature in 2018, and my first meeting with the New Jersey Legislative Black Caucus, maternal and infant health care was at the top of our priority. Now, you have to think about this. This is my first meeting. And so I know nothing about the legislature, but Senator Rice, he said, Queens, I need you to work on this. And so that was April 21st. We did, on September 18, 2018, the New Jersey maternal health hearing was held, and it was led by the New Jersey Legislative Black Caucus. And who was at the table side by side with us? First Lady Tammy Murphy, the administration. They were all there to listen to when we had the doctors, the nurses, the doulas, the hospital administrators. We had community partners, but most importantly, we had mothers sharing their shared experiences. Assemblywoman Space shared her experiences. Assemblyman Conaway was also there with his hat on as an expert in the field. And it was these notable stories that they continue to tell that talked about racial disparities in maternal health care and the rates and the things that no matter how much money you made or what your age was or what your education, those were the things that continue to have no relevance on the maternal outcomes. So again, I want to say thank you to First Lady Tammy Murphy for being a true partner in this vital experience. Thank you to the governor and the administration for being partners with us in realizing that the urgency is to act now, not later, not next year, but we've moved forward so much on the needle from 2018 to 2020 when we first started to here now with this authority. And Tim, I keep reading more numbers in the paper. The last we were up to $70 million from federal, state, and other partners. So I'm going to be tremendously grateful and excited for all to come. And I'm grateful for this investment into New Jersey Maternal, Infant, and Health Innovation Center that will be located right here in the city that I call home, and that's Trenton. It's where expectant mothers and children need care, and they can get it right here in their own community. The Maternal Healthcare Infant Authority will be built on the work to make New Jersey the safest place to raise families by directly supporting the research, the development, the innovation that will improve outcomes for mothers and babies. And again, I can't help but to thank Henry J. Austin because they provide comprehensive care right here in the city of Trenton. And we talk about all of the levels that we have in partnerships. This is what partnership good government looks like, and we're all working together. The creation of this center is not just a public health intervention, it's a lifeline to countless mothers, children, and families. And as legislators, we proudly serve this legislation. We proudly sponsor this legislation because we deeply believe that Trenton, our capital city, with its unique challenges and vibrant community, should be the primary beneficiary. This innovation center will give our community the power to influence change, ensuring expectant mothers and their children receive the care they desperately need, the right to be here, right here at home. This is not about service that we provide, but it's a promise we make to future generations. It's a pledge to address the crisis right here in our own town, to uplift our communities, to ensure health and well-being of mothers and infants. Together, we can save moms and babies. We can together ensure that every mother and every child is just not a statistic. It's a testament to our commitment to our health, to their health, to their lives, and to their future. So today, as we begin a new chapter in New Jersey's maternal, infant, and health care, this chapter is filled with hope, with progress, and innovation. So we are tremendously thankful. And I thank you, Governor Murphy. I thank you, Reverend Boyer, for your leadership in your space as well. But I look forward to having more healthy, lively, full of hope families right here in the capital city. So thank you.
Relina, that was awesome. Obviously, I've mentioned before we hear batting cleanup from the mayor, I said you and Shirley were there from day one, but you also mentioned Shanique and Herb. And Shanique's personal experience and powerful testimony at critical points over the past, now going on 6 years, made a huge difference. And Herb's a medical doctor. Herb is the health head for Burlington County, in addition to being a practicing doctor. And his gravitas weighing in on this also, I think you'd agree, made a huge difference. So I want to thank you all as well. It's funny, you when your nose is pressed against the glass, as we rightfully have it against the Jersey glass, and you're in certain areas and you see the progress that you still have to make. And as I mentioned, the great news is we've gone from 47 or 45, depending on how you count it, to 29, huge leap up. But we also then sit here and say we're 29th. Tammy mentioned that she just stepped down as the National Governors Association spouse head. I stepped down as the National Governors Association at the same time Tammy did as chair. Her playbook, you mentioned the word doula, first time it's been mentioned this morning. Other states look at what we're doing in this space. The initiative I had was strengthening, Sarah knows this, mental health among our youth. You had a big symposium on food security. So the bad news is, folks, we have a long way to go on all three of those areas, particularly in underserved overwhelmingly likely to be communities of color. On the other hand, there are very few states in this country that are ahead of us in any of those areas, or frankly, many others. So it's kind of a tale of two cities. Let's keep our nose pressed against the glass. Don't take any of our blessings and progress for granted, but never relent on the progress that we know we still need to make. So this center is going to be in the capital city. It's going to be a magnet. I hope that it will have some ribbon cutting or something before I hang up my spikes in 2.5 years. But the point is, it's going to last longer than our administration, a lot longer. And I want you to welcome another great leader, the mayor of the capital city, Trenton, New Jersey, Reed Gussiora. Reed.
Thanks so much, Governor and First Lady and the Fighting 15th and Assemblyman Conway and Assemblywoman Spate and our commissioner and all the other valued guests. I do note that Capitol Health is in the House and the Trenton Health team also fighting in a symbiotic relationship to get this job done. On behalf of all the moms and the babies of Trenton and the surrounding areas, all I can do is say, wow. This is the Murphy administration driven by the First Lady, promises made, promises kept. We heard 3 years ago, or now it's 4 years ago, when Tammy made the announcement and everyone just kind of shrugged and said, I don't think so. Let's see where it's going. Well, it's really grown fast, and with the legislative input and with the teamwork of all the health stakeholders, this is really coming to your vision, and it's to your credit that you really stuck with it and you've really championed this cause. You're going to be one of the greatest First Ladies we've ever had, and along with a great husband of yours. His only flaw is that he likes the Red Sox. But Governor Murphy and First Lady Tammy Murphy have been leading champions for maternal and infant health. The Trenton mothers and newborns will be receiving outstanding care as a result of the Maternal and Infant Health Innovative Center. This will truly continue the Trenton makes, the world takes, and while we make babies, we're gonna make a perfect outcome and a great outcome for the moms, particularly in the Black and brown communities that have been far lagging behind in the healthcare access. And we share a brighter and a healthier vision for all the families, not only of Trenton, but of the state and of the world. And it's with the success of this program that we're so excited for. This is one of the things when we're out in the neighborhoods, it's constantly brought up. And we're really, really excited to see this happen. And I know Tim Sullivan's going to provide all the bucks for it. And we're really honored to be an innovative center and really give relevancy to Trenton and maternal health. So God bless the Murphys and the legislators and the stakeholders and the religious leaders that are all going to make this happen. Thank you so much.
Thank you, Reed. And he mentioned Tim Sullivan and the Bucks. I think he's brought small bills with him today, which was the request from the mayor, just to give folks a sense of what this is and what is also going on. This bill, I believe, Steph, appropriates $2.2 million to set the authority up. Separate from that, in this year's budget, through Tim's avenue at the EDA, there's a $30 million capital commitment. I said billion. $30 million capital commitment. Last year was a $20 million capital commitment. We are applying for a federal grant, which if we got it, please God we do, is another $25 million. So the money is coming together here. This is not just words. This is fact. So this is a reality. So as they say in Hollywood, we need a minute or two to reconfigure the stage, but it's a wrap. Give us a second. I'm going to sign this bill in a minute. Let's go.